State of emergency. It's a pretty serious term, and today it goes along with an incredibly serious and important topic. The American Academy of Pediatrics says there's a national emergency when it comes to the mental health of our kids. The problem? It's not new, but the AAP says the pandemic has made it so much worse, reaching crisis levels. I'm Ben Briscoe. From now until 6, we're going to dig into how we got to this point, warning signs to watch for in kids, and resources to help. In fact, right there at the bottom of your screen is a phone number for a free mental health program and hotline. We're going to leave it up during the whole program so that way you have time to save it in your phone in case you ever need it. Because more kids than ever before do need that number. A CDC study says more children ages 12 to 17 are going to the emergency room with a mental health concern. They report a 31% increase between 2019 and 2020. The AAP says they saw a steady rise in teen suicide in the past decade. Suicide is now the second leading cause of death in people ages 10 to 14. A University of Michigan poll found almost half of parents say their child's mental health got worse in the last year. 3/4 of parents say COVID impacted their social interactions, a change doctors say plays a huge role in teens' developments.
It has worsened the crisis substantially. And if you think about the teen years, the young years, getting out, socialization, finding an identity, these are the core developmental tasks of these stages of life. Isolation, not being safe, feeling safe in the world has made it all very much harder.
We checked in with some of our local hospital systems to see where things stand with them. Here's what they told us. Cone Health says they haven't seen a dramatic spike, but numbers did go up slightly. They said they're on track to see more than 1,000 children with mental health emergencies this year alone. Atrium Health, Wake Forest Baptist didn't have specific numbers to share, but they did say their children's hospital saw an increase this year in the number of kids and teens seeking mental health care. You can really see how drastic things have gotten when you look at UNC's campus. UNC gave students a wellness day earlier this month. The school says 2 students took their own lives within a month. The school's chancellor said the school was dealing with mental health crises. He encouraged students to check in with each other. Now, parents organized an event on campus after the decision. They said they just wanted to be there for the students.
I want to be with those students and tell them, hey, it really, really, really will get better. I promise.
UNC's chancellor says the school plans on holding a mental health summit and launch a wellness campaign to address the issues on campus. Addressing mental health can be challenging, so we talked with a psychologist from App State about where things stand with mental health care. He thinks expanding treatment options could go a long way.
There's always a lot of talk about stigma, and that still remains true. And I think the best way to promote the benefits of help seeking is to offer many more options. In other words, it can't be true anymore that we just offer a single type of intervention. We have to be really creative. We have to be ready to do things that are maybe a lighter touch.
Like all of us, he wishes the pandemic it didn't happen. But he is glad it helped shine a light on the country's mental health problem. He just worries we might be a little late.
To call it a national emergency is kind of, in my opinion, late to the table. I mean, we've been screaming about this for decades, and I think in some ways it's escalated this concern at a national level, which I'm happy about. But we've been talking about this as a mental health community for many, many years.
So it's a nationwide spotlight now, but right here in the Triad, there's already a renewed effort to address mental health. Cone Health opened a mental health crisis center this summer. Cone Health psychiatrist says the center helps expand access to treatment.
If we detect people with anxiety and depression earlier on in life, you have better outcomes. Why is it that we don't take the trouble to provide the same resources for behavioral health that we do for physical health?
And there's a push to get more resources out there. Just this weekend, First Lady Jill Biden and the U.S. Surgeon General, they visited a Michigan Indian tribe. The Saginaw Chippewa tribe received a grant from Project Aware to address youth mental health. One of the counselors says it's already made a difference.
I've seen so much anxiety, so much social skills that we have to work on and bring back. And so I actually do groups for like girls' self-esteem, like different things like that.
The First Lady says the pandemic continues to impact people across the country. She thinks the AWARE program can help the country move forward.
As a nation, as a country, we've been through such terrible times through this pandemic, and we needed our country needs healing. And what gives me hope is programs like Project Awareness that goes into the schools and into the communities and helps heal.
One way to get ahead of the program is by knowing the warning signs. The National Alliance of Mental Health lists several things parents can look out for. It says parents should check for changes in school performance, if their child becomes more withdrawn and has trouble sleeping, or other changes in their behavior. Catching the signs early can help kids get the help they need. It's important to know where to go if your child's struggling with their mental health. The good news, there are plenty of options out there. If there's an emergency, you can always call 911. You can text signs to 741-741 for free, and then you've got 24/7 counseling by doing that. And we also have had up the whole show at the very bottom of the screen that hotline number from the Substance Abuse and Mental Health Services Administration. That number, 1-800-662-HELP. It is scary to think someone you love could be struggling, especially our kids. But if you know the warning signs and the resources available, we can get them help they need. If you missed anything today, all this information is on our website. As we go to break, here's that number for you one more time. Take a picture of it so it's on your phone.